It is unbelievable to most people that a fire could occur in an operating room during surgery. However, the operating room provides an ideal environment for a fire to occur since flammable materials, such as drapes, an ignition source, such as an electrocautery bovie, and accelerants, such as alcohol-based skin preparations and superatmospheric concentrations of oxygen, are all present. In fact, it is estimated that there are nearly 600 operating room fires that occur in the United States every year. While most of these incidents do not result in patient harm, it is the responsibility of all operating room personnel to learn and consistently review methods to prevent fires and to minimize the possibility of patient injury if a fire does occur. Several years ago, a fire erupted in one of our Kaiser Permanente operating rooms. It happened very quickly and engulfed the patient's chest and face. While emergency management for the patient was successful, the patient sustained severe burns. The operating room team was emotionally devastated. Several weeks later, doctors, nurses, and OR technicians participated in simulation training on how to both prevent and manage OR fires. One of the most memorable statements was made by the operating surgeon involved in the fire, who said, "If we had received this training earlier, we would have completely prevented the incident." We have recreated this same scenario in the following trigger film. Please analyze and evaluate all of the actions portrayed by the OR team members. A thorough and engaged assessment of fire risk by all team members, with an associated strategy to mitigate this risk, must be made during the preoperative briefing. Think about how you would react if a fire occurred during surgery and anesthesia. The operating room fire crisis checklist will help guide management if this serious event were to occur.
All right, let's do our initial timeout. This is Eileen Paul, medical record number 123456. She's having an excision of a lipoma from her right chest wall. My initials are there for verification, and she is at red risk. Anesthesia?
Patient has no known drug allergies, is not on a beta blocker, is not diabetic. No antibiotics were ordered, and the plan is to do local sedation.
Okay, everyone agree?
Agreed.
Okay, let's get started. Whoa, fire! 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 Santa? Yeah, call for help.
Okay, I'll
and
call
get the
for
fire
help.
checklist.
I'll call for help and get the checklist.
Do we have the fire checklist?
Yes.
I heard there was a fire.
Yeah, there's a fire. Patient burned on their right side of the face and chest wall.
All right.
Okay.
So how's the airway?
Airway's fine. Patient spontaneously breathing. Saturation's 100%.
Okay. Let's assess the patient for injury at the site. What do we see?
Burning on the right side of the face, right neck, right chest wall.
Okay, let's go ahead and intubate.
Okay.
Let's confirm that there isn't a secondary fire anywhere.
No, I was able to put the fire out with sterile water.
Okay, perfect. Great. Let's continue to check the patient's status. How is he doing?
Vital signs are still fine. Heart rate's a little high, but saturation is 100%.
Okay, perfect. Let's save the involved materials for review.
Okay.
Okay, Sass, I'm gonna start giving the medications to intubate.
Dr. Smith, we're going to manage the airway with an endotracheal tube.
Okay, Sass, thanks. Great plan.
Thank you for meeting to talk about this fire that happened with our patient Eileen. We thought it'd be a good idea to debrief about the situation. So let's talk about some strategies that we can do to prevent this from ever happening again. And if it does happen in the future, maybe some things we can do to better manage the situation. So Senna, can you please go get the OR crisis checklist and let's review the fire.
Yeah, I'll go get it.
All right, let's do our initial timeout. This is Eileen Paul, medical record number 123456. We're doing excision of a lipoma of the right chest wall. There's my initials. Please verify that. Since we are doing surgery above the xiphoid process, let's determine her red risk.
Yep. So this patient has no known drug allergies. She's not on a beta blocker. She's not diabetic. there were no antibiotics ordered, and the plan for anesthesia is local sedation. I am using an open oxygen source. However, if you let me know prior to using electric cautery, I'll turn it off.
All right, thanks, Sass. I'll definitely let you know when I'm using electric cautery so you can turn it off.
Thanks.
And due to this being a high red risk, let's go ahead, Senna, and ensure that we have a non-alcohol-based prep solution.
Okay, I have the betadine ready.
Okay, great, thank you. All right, everyone agree on the plan?
Agreed.
Okay, let's go ahead and get started.